Hello, my name is Tanya Kane, and I'm doing my second persuasive speech on policy. And my topic that I chose is mental health counseling in schools. Schools should offer more mental health counseling. We have an alarming issue among our youth in the United States. There is a rapid increase in mental health of our youth today. Depression, anxiety, and academic stress are only a few of the mental health issues found in our school-aged children. Mental health counseling at schools makes process easier for students to ask for help. They may also obtain help sooner and within the same building that they learn in. That is according to the USA News. Offering mental health counseling at schools prevents students from having to wait for long periods of time to get the help that they need from the outside sources due to such long wait times. The National Association of School Psychologists recommends that one psychologist for every 500 students. In some states, it's as high as one psychologist to 5,000 students. That is insane. While the American School Counselor Association recommends a ratio of one counselor for every 250 students. However, the nationwide average is actually one counselor per every 415 students. If we want better outcomes for our students, we need more mental health counseling services in our schools now, not tomorrow. According to U.S. News, there are more than 2,500 school-based health centers across the United States. But really, is that enough? The school-based health services offer treatment for anxiety, depression, and other mental health issues. According to the Institute of Health, estimated 12 to 30% of school-aged children suffer from some form of mental health illness that affects their education in some way, shape, or form. The vulnerability to mental illness is the highest during childhood to adolescence, because an estimated 50% of all mental illness begin before the young age of 14. And 3/4 of mental health issues occur before the age of 25. The next number is huge. An estimated up to 75% of students suffering from a mental health illness fail to get proper treatment, and some don't even get treatment at all. National Alliance on Mental Illness, which also known as NAMI, it says 1 in 6 U.S. youth ages 6 to 17 experience a mental health disorder each year. For people ages 15 to 40 years who are having symptoms of mental health issues, the average wait time is 74 weeks. Yes, that's 74 weeks, not 74 days, which is almost a year and a half before receiving treatment. That is unacceptable. Mental health untreated can lead to early death, such as suicide. It can lead to drug abuse, arrest, and so much more. Matter of fact, suicide is the second leading cause of death among youth ages 10 to 34. A 10-year-old dying by suicide is hard to think about. When students who have mental health issues receive the proper mental health treatment and counseling, their attendance improves, they are less likely to drop out, and this allows the students to obtain their maximum academic potential. Mental health counseling also develops a safe and supportive learning environment And the sooner the students receive the counseling, the easier it is to prevent the larger issues. Offering more mental health counseling in our schools to students helps develop the foundation and support for students to succeed, not only in school, but also for the rest of their lives. Counseling also helps students to feel like they are understood, that they really do matter. It teaches them how to handle their emotions, strengthens and develops their coping skills, which they can use for the rest of their life. Let's lower the numbers, the ratios, and wait times for treatment, and offer more mental health counseling because our kids matter. Thank you.